Hi guys, Mark here from markchenmovement.com, and in this video I want to give you a little bit of insight on back pain and how to handle it. And this came to me after I've been doing a couple of months of assessment at CrossFit Ichi for the members over there, and there was a significant, and by significant I mean about probably 80% of the people that I saw for consultation were struggling with low back pain. So I thought it would be a good idea to cover a couple of things in the video in how you can decide how bad it is if you're running into low back issues and what you need to do. And by what you need to do, I mean, should you be consulting a professional, or is it probably not that bad? So what we're going to do is I'm going to give you a little bit of insight on back pain itself, and then I'll give you a couple of questions that you can ask yourself in order to get a good idea of what's going on. So a little bit of background: the amount of people suffering problems with the spine is massive. I've seen this in the 10 or so years I've been working in the clinic, and actually recent evidence suggests that about 80% of all people gets to deal with back issues, whether that's up in the back or low in the back, issues somewhere in their life. Now, there's also a good part of this, and that is the following: most of these issues are what we call non-specific back pain. Now, there's two categories you have to keep in mind. Specific ones, which pretty much means there is some kind of damage to be shown, something that would show up on a scan. And then we have aspecific, which pretty much means there's no damage that would show up in a scan, but there is some kind of an overload issue going on, whether that's muscle or tendon or ligament. For this moment, that does not matter. The good news is 80%, 90% of all these problems are aspecific. And for these aspecific problems, they've indicated that between 0 and 6 weeks, you should be back to your 100%. So this is good news. Now, if you are struggling with back pain, you're waking up, you got a sore back, and you're wondering what's going on, these are the questions you need to be asking yourself. Number one, the pain. Has it been caused by a trauma? And trauma could be doing a heavy kettlebell or a clean and jerk or an overhead squat, but it could also be something else. Could also be, getting hit by a car or having someone tackling you. Anything that involves a high velocity of speed usually can cause injury and actual damage to the body. So has there been an actual trauma, an actual moment where you went, ooh, and you basically had to stop the activity that you were doing? This is not a good sign, and it would put you a little bit more into the direction of the specific injury. If that's not the case, so you just woke up and it's seemingly without any reason you're struggling with back pain, puts you more towards the non-specific back pain, which is a good sign. Question number two: the pain that you feel, is it local? Like, could you point it out with one finger and say that's where it is, or is it spread? And if it's spread, is it going to any other parts of the body? And when you're struggling with low back pain, specifically the legs are very important. So if the pain is very local, you can point it out with one finger. This is a good sign. If it's local, it's changing location, you feel something in one of the leg going down to the foot, or even on both legs, this is a bit of a bad sign and puts you more towards the specific part. Then we have number three: is there any sense of control issues? And control issues could be muscle control issues. So you start to notice that your leg is not working properly, or your knee is starting to buckle, or even you have problems with your bladder, for example. But it could also be skin related. So it could be that the skin on your leg suddenly feels very numb, or the sensation of the bottom of the foot has changed. These are not good signs, and they will put you more towards specific issues. If you don't have any of these things, no muscle control loss, no sensation changes in the skin, good sign. Then we have question number four, and this is a very important one. The pain that you feel, can you influence it? If you can change position, lay down, sit in a different way, change the position of your pelvis, and by doing any of all of these or all of these things, change the amount of pain immediately, that's a very good sign. If the pain is constant, it doesn't matter what you do, sitting, laying down, standing up, moving, not moving, the pain stays exactly the same, this is not a good sign. So to keep the focus on the good part, what you want to look out for when you have low back problems is preferably non-traumatic. No accident that makes you go, ooh, back pain. You have to stop what I'm doing. Second, the pain, local, should not refer too much to other body parts. 3, no control issues in and around the back. Skin sensation has to be the same as well. Then 4, you have a way to influence it by either stretching, changing position, whatever. If these 4 are covered, you're most likely in the non-specific low back population, and that is a good sign. It also means once you have influence, you can take steps in speeding up the process, optimizing the way that your back is recovering. Because you may not be able to perform at the level that you're used to for a certain amount of time, but that doesn't mean you have to stay at home and do nothing. There's always things that you can do. So I hope this gives you a little bit of an indication of how to handle back pain. Of course, when you have questions, either drop them in the video or book a consultation with me and we'll go into it a little bit more. Any questions, let me know, and I'll see you next time. Bye.